Throughout his long and distinguished career from senator to president, Joe Biden has undergone a remarkable journey. From his early days as a young senator to his current role as the leader of the free world, Joe Biden's face and hair evolution has sparked quite a bit of curiosity. Has he remained all natural amidst being in the spotlight for 5 decades, or has he had plastic surgery at some point over the years? Today we'll explore Joe Biden's transformation and examine any possible procedures he may have had along the way. Stay tuned for the cost of these potential procedures at the end. In 1965, at the age of 23, you can see that Joe's hairline has already started to push back. He has some frontotemporal recession, and you can see the degree of recession when you compare back to when he was 9 years old. Joe's brows appear flat and they're resting right on the brow ridge. He has a flat nasal tip cartilage appearance, and he has no bulbosity to the tip of his nose. He also has full upper tooth show on smile, and you can really appreciate the strong jaw structure that Joe Biden has. In 1968, at the age of 26, now Joe Biden has a Norwood 2 type of hair loss. And this would have been the time to start on medical therapy, such as on finasteride and minoxidil. Though keep in mind that those 2 medications were not available until the 1990s. To find out more about that medical therapy, along with other things that you can do to improve the state of your hair, head to feelconfident.com. In 1972, at the age of 30, this is when Joe Biden first became senator. And you can see that his hair is now at a Norwood 3. And notice also that the temples are almost gone. He also appears to have static forehead rhytids and some under eye hollowing. In addition to his nasal tip cartilage not being bulbous, it does happen to be cephalically positioned, which means that the lateral crura of the lower lateral cartilages actually points more toward the medial canthus of the eye compared to the lateral canthus of the eye. This type of composition sometimes leads to people not being able to breathe as well through their nose, though that might not be the case with Joe. As you redirect those cartilages out more laterally, you create more airflow through the nose. In 1974, at the age of 32, there is now progressive frontal scalp thinning. And you can see the technique that he's using with his hairstyle, which is to comb the hair over from left to right. That can sometimes give the illusion of more density. In 1975, at the age of 33, now I'm seeing some mid-scalp and crown thinning as well. In 1980, at the age of 38, what you can appreciate here is that Joe Biden has near complete crown loss. So while he still has some hair to comb over in the frontal scalp and the mid-scalp, in the crown area, there really isn't much to work with. In 1983, at the age of 41, there are signs of a potential hair transplant, most likely with plug grafts, most likely to the hairline and the frontal scalp. Punch grafts were done by taking a 4mm punch from the back of the scalp. Usually it had about 20 to 30 hairs per single punch, moving that over to then the frontal scalp. As those were placed, they tended to give a more pluggy appearance or a doll's hair type of appearance, as we showed with Donald Trump's potential hair transplant. And you can see that the temples were left essentially untouched, and that was usually the case with plug grafts, because it was difficult to get the proper angles and to give the refinement necessary to be able to do temple work. Check out our video on Donald Trump to learn more about the plug graft procedure. In 1984, at the age of 42, what you can see from the plug graft procedure is that there are heavy grafts at the hairline, and it doesn't look completely natural. We have a video on how to fix a receding hairline that goes in detail about how to create naturality at the hairline. You can also see here that with the aging process, there is now lateral brow descent, and this happens as the tissues lateral to the temporal crest start to weaken and descend with time. There is also dermatochalasis of the upper eyelid, or essentially excess tissue of the upper eyelid that is weighing down over the eyes. In 1987, at the age of 45, what these pictures show us is the importance of the hairline and the forelock for creating the perception of good hair from a frontal view. But my guess is that at this point, he has little to no original hair in the DHT sensitive zone. But just by recreating that little bit of hair right at the front, he looks like a person with hair. Unless, of course, you look from the side view or from behind, then you start to appreciate the hair loss. You can also see that at this point, Joe now has a loss of jawline definition as his neck fullness has increased and the face has started to descend. In 1988, at the age of 46, I wanted to point out here that there is now philtrum lengthening and the lip corners are more downturned. And again, these are just signs of aging as our skin lengthens and it starts to hang down with the effects of gravity and our tissues atrophy and weaken with time. And in 1990, at the age of 48, you can see a very different Joe when you look from the front compared to the side. And the two main reasons for that is that from the front, again, you see that hairline and forelock that's giving us the impression of Joe having good hair. And then also, it's difficult to really tell that there's much laxity in the neck. It looks like his jawline is pretty clean, but as you look from the side view, you can really sense that lack of definition in the jawline and that hair loss that now exists there in the mid-scalp and crown areas. In 1992, at the age of 50, there is now glabellar rhytid deepening, and his upper eyelids are now starting to potentially obstruct his field of view from what I can see in this photo. And that is sometimes an indication for an upper blepharoplasty that's done for functional purposes, not just for cosmetic indications. In 1993, at the age of 51, I do see some additional hair now at the frontal scalp, and it appears to me to be positioned slightly lower than what I saw previously. This suggests that potentially Joe Biden may have had more plugs placed around this time. Remember that FUT surgery was first described in 1995, and since this is 1993, I don't think he had an FUT at this stage. And in 1994, at the age of 52, since these potential hair transplants have focused on the frontal scalp and hairline, he has now adopted a different type of hairstyle, where he switched from a comb-over type of approach to a comb-back approach in order to make the mid-scalp and crown appear more full, even though they're fairly devoid of hair. In 1995, at the age of 53, there is now some signs of lower eyelid pseudoherniation, which is like the bulging fat pockets that you sometimes see. And there is continued increased neck laxity that has occurred over time. In 1998, at the age of 56, his hair is looking less pluggy and more full. Now, this might be because of a possible FUT type of hair transplant. Remember that FUT surgery involves taking a strip from the back of the scalp, dissecting it under the microscope into follicular units or small grafts and placing them along the hairline or frontal scalp or wherever you need to increase density. Now, for patients who've previously had plug type of hair transplants, the options for repair or revision work include either removing those plugs and then placing these types of smaller grafts that we do these days, or by working around those plugs and using FUT or FUE technique to extract out grafts and to place them around the plugs to soften the appearance. Now, I'm not sure exactly which type of approach Joe Biden had, but it was most likely one of those two. And most likely the harvesting approach was FUT because, again, FUT was described in 1995, while FUE surgery was described closer to 2002 and became more popularized around 2010. And also, it looks to me like Joe Biden may have had a brow lift around this time. Compare back to the image from 1978, and you can see that there's more infrabrow space. And we have a video that we've done in the past looking at the different techniques for brow lifting, so make sure to check that out. In 1999, at the age of 57, you can see that there is temporal thinning, not of the hair specifically, but of just the temples on the sides of the head. Now, some people choose to get filler into the temples to make them less concave, but there are some concerns there because as you place filler into that delicate area, there are important blood vessels, and if you get filler into a blood vessel, sometimes you can have bad problems, such as even causing blindness, which is rare, but it can happen, so you have to be very careful. Also, as you start to inject filler into the temples, you want to make sure that you're not lateralizing that area any more lateral than the actual cheek. And because as you do that, things start to look very unnatural. So I don't think Joe Biden had any of those procedures at this stage, but I'm just giving you guys some reference points for those types of cosmetic procedures. In 2009, at the age of 67, Joe Biden becomes vice president. And the main aging sign that I'm seeing here is that there is skin laxity in the neck, and we sometimes call this turkey neck. Now, this is difficult to treat non-surgically. There are, of course, some radiofrequency devices that tighten the area, and we've spoken about that in other videos, but there's truly no way to reposition all that tissue because it's extra skin that has sagged down. There's also some fat there and weakening of muscles. So the two main surgical ways to address it is either through a full facelift neck lift, where you're going to resolve that extra skin and the tightening of the tissues from the inside and resolving that skin laterally. The other option is a direct type of lift of the neck, and that's done right through here. And as you do that, there are, of course, some visible scars right down the center of the neck, but typically what's used is a Grecian urn type of design to reduce the tension on the area and to make it less obvious once the scars heal. You can go in there, remove some extra skin, extra fat. You can also tighten up the platysma muscle and improve the area. And those are just some of the options that are available for people with a similar type of configuration. In 2012, at the age of 70, while the frontal scalp has hair still, the mid-scalp and the crown are nearly fully bald. And to me, there are some signs of a potential lower blepharoplasty, where those bags, that pseudoherniation that he had prior, are now less obvious. He has this smoother lower lid to cheek transition, and that makes him look less tired and more youthful. In 2014, at the age of 72, the nasolabial folds have become deeper, and notice how his lips have thinned out with age. We lose things like elastin and collagen as we age, and that is partially what leads to a thinner appearance of the lips. And also notice how the philtrum has lengthened. And as you compare back to Joe Biden at age 23, you can really see these aging-related changes. In 2019, at the age of 77, there are some signs of a facelift and neck lift procedure. Joe has improved jawline definition. He has reduced submental fullness. His midface also appears more elevated. And we do see some scarring around the ears, which is a standard location for facelift procedures. When you're designing incision placement for facelifts in men, one important consideration is whether or not you should go pretragal, which is right in front of the tragus, which is this little piece of cartilage, or if you should go posttragal with your incision. If you go posttragal, which is very common in women, if you do that for men, you're going to essentially pull the beard hair over the tragus. And then you're left with the options of either letting some hair grow out on your tragus, which doesn't look totally natural, or doing something like a laser hair removal for those hairs. The advantage of going pretragal is that you get to avoid that type of hair displacement laterally. But sometimes the scar can be in a little bit more of an obvious location. But if you hide it in a fold or a crease right there in front of the tragus, usually the results are just fine. Most of the unsatisfactory scarring that we see with facelift surgery has to do with excess tension that's built into the area. And that's usually from the lack of release of tissues as the facelift is done. In 2020, at the age of 78, again, I'm seeing potential facelift scars in their typical locations. You can also see the portion of the face that appears to actually have been undermined and lifted. You can see how pulled that area seems, and you can almost tell where they finished their dissection immediately. It doesn't look like that dissection went all the way towards the nasolabial folds, which is often what's done with a deep plane type of surgery. It looks to me like they had stopped right along the area of the lateral canthus. You can almost tell where that demarcation is. And I'm also seeing on his right side that there is a pixie ear deformity, where the earlobe gets dragged down with the scarring as you heal from a facelift, and you lose that earlobe definition. Instead, it looks like a webbed area there. And that often stems from, again, tension being built up. If you want to reduce tension on your closure, you need to adequately release the tissues, and that is exactly what deep plane surgery is meant to do. So I would guess that Joe Biden did not have a deep plane facelift. It was most likely a SMAS plication or an imbrication. In 2021, at the age of 79, the right pixie ear persists. the submental area is now almost back to where he started. So this brings us to the discussion of the longevity of facelifts and really any type of lift that's done on the body, but especially with facelift surgery. So the most that you can expect to get out of your facelift is maybe 10 to 15 years, but depending on the technique and of course on the patient's anatomy, sometimes a facelift will only last for 6 months to a year, which is of course upsetting to most patients because they typically pay a lot of money, they go through a big recovery period, they take a lot of time out of their schedule. But it's important to remember that not all facelifts will last for a decade or more. Usually the procedures that are done more extensively with solid release of all the ligaments of the face and really a true repositioning of the tissues will lead to a longer lasting outcome. The ones where the skin is just a little bit undermined and released and just a little bit is trimmed down and there isn't as much deep work, those usually will not last as long. The total cost of these potential facial and hair plastic surgeries is $145,000. Do you think Joe Biden has had any facial or hair procedures? Let me know what you think in the comments below.